So I'm here to talk to you about Bill's story. This is Bill and I'm Bill's daughter. My parents are very different people. The one thing they had in common, their concerns about their ageing and their dying were they handled those in very different ways. The one thing they have in common is both of them wanted to have as much control over their dying as they have had over their life, and boy, are they both control freaks. They also wanted to maintain their independence as far as possible. My father did this by working through the process that I'm going to talk to you about in terms of an Advance Care Directive. My mother has done that by continuing to worry so much about the loss of her youth and the concerns about her ageing and her fear about loss of independence, that she still isn't in a place where she can openly have that conversation. She'd rather, as she says to me, I'll deny it as long as I can. What I've done is left that open to her and said, I'm happy to have that conversation with you. And every now and then I revisit that and say, would you like to have a conversation about this? And up until this point, she says, back off, I'll let you know when. That would be my mother. Bill, however, was very different, and we certainly moved down the path of an Advance Care Directive. And being a nurse and being the daughter of my parents, I'm also a bit of a control freak. And being a policy writer and a person who loves to develop forms, filling out forms is also very appealing to me somehow. I think my father had this discussion with me because he knew I didn't really have a life, and so filling out a form for him was probably, something we could occupy our time with. So how did we start the discussion? My father approached me only a couple of years before his death about would I help him with his will. He wanted to write it. He hadn't had one up until then. I'd nagged him about that, and he said, I think it's time. I want to get all my ducks in a row. I've hidden some money in the cushion in the couch. I've put masking tape on the back of things in the house with people's names on them that I want them to have. I've got myself a funeral plan, and I just want to make sure none of this stuff is left to any of you. So when we talked, and we did do his will, and we worked through that process, and so that gave me the opportunity to have a discussion about having an Advance Care Directive with him. And he was unsure about what that was, but it also raised some concerns about he didn't really know how to talk about his death because he didn't know what it was going to ultimately look like, and that's a fair comment. So the one thing when we did start the conversation was, what he said was he didn't want things like no heroic treatment or the end stage of a terminal illness, because he said, I don't know what they mean. They sound very medical to me, and I don't think I'll know when I'm at the end stage of a terminal illness, so how will I know what decision to make about that? But he did have some very clear intent about how he saw the end of his life. And so we talked about what do you want that to look like, and what things do you value, and we can put those sorts of things into the directive and be really clear. So although eventually we sort of had some very clear indications about what treatment at what stage he would refuse, what was most important to him was in fact making clear what his intent was. So any health practitioner who had final carriage of decisions about treatment understood who he was and what was important to him, and he felt that was a way to help people make decisions. So this is what, in the end point, he talked to me about, and this is what we ultimately wrote into his Advance Care Directive. As long as possible, I want to live my life independently, even if this requires domestic or personal care support. I do not want to live in a nursing home. This would be the very last resort for me. I do not want any medical treatment that would ultimately result in me having to live in a nursing home. In the event of cardiac arrest, I do not want to be resuscitated at the end stage of my life where it might prolong my life without quality of life. The things that were important to my father, which in fact we didn't put into the Advance Care Directive, was smoking. My father had smoked his entire life from when he was 13. He had a mild stroke when he was 56 and gave up smoking for 5 years and then returned to smoking, but he was a very heavy smoker. The other thing that was really important to my father was brandy. And he liked to have brandy. He had brandy and milk at breakfast time, and he had brandy with his corned beef sandwich for lunch, and he had brandy with his devilled sausages for tea. And generally when he was watching something at the end of the night, he had a bit of a toddy to finish off the day. The reason my father didn't want to go into a nursing home was because he didn't want to not be able to smoke, and he didn't want to not be able to drink his brandy. And in reality, they were the most important things to him. So I understood that. I didn't think we needed to share that information. I thought just as an ultimate last resort was enough in making that decision. So my father died in 2015. He wasn't in the end stage of a terminal illness at the beginning of the process. He was an emergency situation. He was found unconscious by the people that came to clean his unit. They'd been contacted by Meals on Wheels, who had turned up on a Monday morning and found that his meal was still there from the Friday before. He was rushed to the Royal Adelaide Hospital, and it was found that he had a ruptured bowel. And so there was a need to rush him into emergency surgery, which I consented to. I talked to the other members of my family. My mother and father had been divorced for 20 years, but had become ultimate friends is probably a bit more. Some mutual respect and some lived history is probably what their relationship ended up being. I have 3 siblings. I talked to all of them. The rest of my family didn't want to come into the hospital for quite some time. They were quite uncomfortable with that, and they felt that as the family nurse that it was best for me to do that because they thought I would, do what was necessary. But I spoke to all of my family members through all of the stages. My father came out of surgery into ICU. He hadn't regained consciousness. They'd resected 2/3 of his bowel, and he had a colostomy bag on the outside, which is bringing a part of his bowel onto the outside of his stomach, and he had a bag. He also, during that time, his kidneys had failed. And so in ICU, they'd commenced him on a round of dialysis to try and get his kidneys to work. During none of this time did he regain consciousness. At the end of that point, that still didn't kick in his kidneys, and so the doctors talked to me about starting another round of dialysis, and at which point I had a conversation with them about what we needed to do next and what we needed to talk about in terms of his Advance Care Directive. So there were 3 things that I asked him. I asked for a meeting with the head of the ICU unit and also the medical specialist, the surgeon. And I asked them these things. What's the likelihood of a reversal of the colostomy bag in the long term? What's the likelihood of returning to full renal function or even good renal function if he started another round of dialysis or kept up with that? And what was the likelihood of him ever being able to return home at the end of this? And to each of those things they said, we could possibly get his kidneys working. We don't think it's possible to reverse the colostomy, and he probably would not be able to live independently. For me, that immediately told me that his wishes were that he didn't want anything that would put him in a nursing home, and I knew that he wouldn't cope with those things. I knew the thought of having to go to dialysis twice a week and having to manage a colostomy and moving into a nursing home would not be my father's wishes. And so we talked then about discontinuing that treatment, not restarting dialysis, and enacting his Advance Care Directive, which the medical specialists were comfortable with and certainly then documented in his notes. The following day, interestingly enough, I was actually driving to get wood for the fire. My daughter and I were heading up to Mount Barker, and while we were in the car, I phoned the hospital to see how he'd gone that day, and I was told by the nurse that they were about to restart the dialysis because they'd done some bloods and the indications were they needed to do that. So I asked to immediately speak to the doctor on duty at that time and informed him of the Advance Care Directive and the fact that we would not be undertaking any further dialysis. That doctor was very concerned at that point in time, and his comments were that that we couldn't discontinue treatment, that I would need to come in and sign a release to do that, and in his medical view there was a need and a reasonable rationale for commencing dialysis. I told him I was turning the car around and would be there in 45 minutes. I told him just because the notes had moved on to a new page didn't mean he didn't have to read the previous pages. I said I'd give him 15 minutes to have a conversation with whoever he needed to, and I would then ring him back from the car. I told him if he commenced any treatment before I arrived at the hospital, I would have his guts for garters. I rang back in 15 minutes and he said, "I fully understand, we won't be recommencing treatment and we'll see you when you get here." At that point, I talked to them in ICU about this is no longer the place for him. You know, it's time now to move him out of ICU onto a ward, and I asked them to make the referral to the palliative care team. He was moved onto a ward. The remainder of my family members and his brother were able to visit him, and he died 4 days later without having a return to consciousness. He was comfortable. He was comfortable in his death at the end of that time, and everybody had been to see him. It's hard to know whether that's a good death because I didn't go through it, but for me, we did everything in our power to achieve what it was that he wanted. So this is some of the rest of the members of my family. This was at my daughter's 21st. My father is the pirate, as you can see. My brother is brandishing the scaber. That's my sister and my daughter, who's 28. All of my family members have an Advance Care Directive, except my mother, and I've told you that reason why. My daughter has one. She travelled a couple of years ago overseas for quite a long period of time, and we talked about it. The time to talk about it is why it's a hypothetical, and while you can have a bit of a laugh, you know, I think when it's not real and it doesn't touch a nerve or fear. My daughter says sometimes it's really difficult having a health practitioner as a mother because we've had conversations over the years that she didn't really feel she wanted to have. But she has that, and we've had very clear discussions about what we want. I know the intent and the wishes and the values of the rest of my family, and I feel safe because they know mine, and I think that's a good place to be with family. Thank you very much.